Good evening, everyone. I am Richa Sehra, founder and editor-in-chief, Responsible Hospitals. And today we'll be talking about hernia in the depth. And we'll be having Dr. M. Madan with me. He's a director, MITI and Minimal Access. And he's been with CK Birla Hospital. And we'll be talking more on this topic as a lot of people have been requesting since long time. And I thought it's the right time to talk about it. So I'll be just adding him right now and we'll be starting the session soon. Dr. Ma'am, can you just see me? I've just tried adding you. Good evening, Dr. Ma'am. How are you doing?
Hi, Richa. I'm good. How are you?
Nice to have you here. I'm good too.
Yeah,
Thank you so much.
yeah. Thanks to you
So,
that I'm here. Yeah.
yeah. So, Dr. Mayank, since we have been, a lot of people were requesting about this topic, and I thought it's the right time to talk about it. So, I think let's start with a very simple question, which people are not even aware that what you think, what is hernia actually in your simple terms, so that people can understand and they can actually relate in case anyone is going through such problem.
Okay. Simply means, can you listen to me?
Yes, yes, I can hear you now.
Yeah. So hernia simply means something protruding out of its normal location. Normally, this thing is seen in terms of abdomen only, usually in terms of abdomen. If any abdominal content is coming out of its boundaries, so we call it a hernia, strictly speaking. So, as you know, in the abdomen, you have certain organs which are fixed, certain other organs they are lying loose and free. Most of it is the small intestine and a part of fat, which is called omentum. So, if it tends to come out of its boundaries, means the abdominal wall,
Okay.
then we call it a hernia. Okay.
Okay. So how do somebody gets to know about that, this is a problem of hernia? What is the way to, understand yourself that, this is the problem you are facing? Is there any
Okay.
clue or they get it?
Yeah. Yes. Yes. And it's a very obvious clue, I'll say. If you have got any particular swelling which is protruding out of your abdomen, then you can really be get little cautious that it might be hernia. Normally, what you find that on all your abdomen, it's just one single bone on the back. It's your backbone. On all
Okay.
other four sides, all other sides, it's the muscles which are containing all the organs inside. So if at any abdominal wall, any part of abdominal wall, you find an abnormal bulge. I'm not talking of simple swelling or a lump. I'm just talking of a bulge. If you find abnormal bulge somewhere,
Okay.
then probably you have got some hernia. So normal sites, you can actually keep on checking yourself whenever you take bath or you take change your clothes. You can see normally the sites are the groin region. Groin is the area where your abdomen meets your thighs. So at
Mhm.
that part, and the other common sites are the anterior part of your abdomen, means the front part of your abdomen, right from the center of your chest bone till your pelvic bone. So
Okay.
usually these are the sites where you might have some abnormal bulge.
Mm-hmm.
And more so if you find that that bulge is coming out and going back in,
Mm-hmm.
then of course it's a little more sure sign of having a hernia. And you
Okay.
should actually consult a doctor to confirm it.
Sure. And what are the causes of hernia basically? How does it happen? Why does it happen actually?
See, there are two different mechanisms in play whenever there is a hernia. One mechanism is something is trying to keep the contents inside. Okay,
Mm-hmm.
that means the integrity of the abdominal wall that has to be maintained. So that depends on the tone of your abdominal muscles, the integrity of the abdominal muscles. One thing is this. The other thing is the abdominal pressure per se.
Okay.
So if the pressure is high and your abdominal wall is not able to contain it, then there can be herniation. So there can be n number of reasons for these. In certain cases, in most of the cases, I'll say it's idiopathic, means you can't find out the cause per se when you go into it. But most of the times, it can be a natural defect, like in
Mm-hmm.
case of males. the blood
Mhm.
supply to the testis that goes through the abdominal wall musculature. So there is a natural defect in each and every male. So the males are actually a little more predisposed to having these groin hernias because there is a natural defect already there in the muscles. The
Okay.
other thing can be if you have had any surgeries before.
Mm-hmm.
So that area, of course, becomes weakened. Though as surgeons, we try to repair that part and suture it back. But yes, definitely it becomes a little weak than your actual body has been made by the God. So those are the sites or the reason that you can have herniation. Then there can be some specific patient related factors in people who are in habit of straining too much. So those are the people who are into weightlifting, people who are into too much of exercise, gymming, then people who have chronic um, coughing, means patients who are asthmatic. So they are
Mm-hmm.
perpetually coughing. So abdominal pressure keeps on increasing in these people. The other set of patients can be those who strain too much while passing stools, or those people who are straining too much at passing urine also. Then old age, definitely, because in old age your muscles they become weak in any case. Other
True.
set of patients can be, which are very, very high risk patients. They are obese patients,
Right.
overweight patients, because in them the muscles, the fat gets accumulated between the muscles, and actually the strength of muscle is less. So
Right.
these can be certain causes, and people, especially who are chronic smokers, yes, they have, they can have weakened muscles. Yes.
So, any specific age that that this is the usual age which it's to the hernia, or do you think no, it doesn't happen to kids, it happens to majorly adults or let's say senior citizens? Do you think
It
is there any?
usually, yes, yes, it's a very pertinent question. Uh, it usually happens on extremes of ages, I'll say. In
Okay.
kids, as I told, yes, kids definitely, in which there can be congenital hernias. See, as I told you, the blood supply to the testis that comes through the abdominal wall. So there is a natural defect. Sometimes that defect remains widened up in kids. Naturally, that has to regress in over a period of say 1 to 2 years. So in kids, there can be a natural reason. There can be congenital hernias. Then it can happen in extreme, the other age, the old age, because
Okay.
already the muscles have started growing weak. So in
Hmm.
those people, again, you can have hernias. Then rest of the reasons, if you say by going by the previous surgeries, then
Hmm.
yes, it can happen in certain adults who have undergone surgeries. So especially females, I'll say, because of cesarean sections or other sorts of intervention in the abdomen, they usually have more interventions in abdomen rather than the males. So in young age, we find more of the females which are coming to us with hernias. And whereas in the extreme of ages, it can be both males, females, but usually, yes, males are much more common.
Okay. And what are the kind of hernias? Are there any types of hernias also?
Yeah, as I told you, the first and foremost and the most common type of hernias is the groin hernias. We categorize hernias according to the location where it happens.
Okay.
Okay.
All
So
right.
location most commonly is the groin part. As I told, it's the area between your abdomen and the thighs. So there can happen groin hernias. Again, 90% of these patients are usually males. You can have inguinal hernia at that part. You can have some of the hernias which are growing into your thigh, inner thigh region also. So those are femoral hernias. All those are usually the male patients. Then there can be hernias location-wise in your anterior or the front part of your abdomen.
Okay.
Frontly, as I told, between your chest bone, the lower end of your chest bone, and the pelvic bone. So here you can have most commonly the hernias can happen near the navel, where we call it umbilical hernias. So all these hernias are little more common in females. So
Okay.
umbilical hernias can happen if they are above the umbilicus level or navel level, we call them supraumbilical hernias or epigastric hernias. Then we can categorize them according to the if there have been previous surgeries. If there is a previous surgery, there is a scar there is a cut there, then we call them incisional hernias. They can happen anywhere, wherever you have had a surgery before. That area is prone. And then one more type which needs special mention, that is called hiatus hernia. Hiatus hernia, this is an internal hernia.
Mm-hmm.
Means you can't see a bulge inside. Here, a part of your stomach is going up into your chest. So usually these are the patients who come to us indirectly. They'll come to us with some problems of gastritis, acidity, or some heartburn, and then we think, okay, maybe there is some reason that the stomach might have gone up, which is causing the acid to go back. So these patients usually come with reflux. So these are hiatus hernias, which actually need special mention. And I want
Mm.
this to mention because most of the times we ignore this symptom,
Yeah.
calling it that, okay, it's simply an acidity. I have
Yeah.
gas issue. So one can have actually hernia here happening
Okay.
inside your abdomen, and you can't
Mhm.
actually see that.
So,
So
what are
again,
the
these are the
symptoms
things.
again? Since you correctly mentioned that people usually have a habit to, say it very easily that it's a gas or it's an acidity. I think
Yes,
mostly people use this term, and very frequently they, get inside this feeling that there is a gas and acidity. They find it normal. They take Pandy or
yes.
whatever tablets they want to. So how do they
Mhm.
actually get it that no, this is something else? I need to see the doctor. This is a symptom which I am facing that it could be relating to this hernia.
Yeah.
So what kind of symptoms usually people feel?
So this is, we are talking of hiatus hernia.
Hmm.
Actually, the patients will be having symptoms of acidity, burning sensation in upper abdomen going into the chest.
Okay.
So if you have frequent symptoms of acidity or burning sensation in your chest, this is quite an indication that you should go and consult a physician and not just simply keep on popping some pan 40 or some pan top, whatever,
Mm-hmm.
home, or maybe some home remedies also.
Mm-hmm.
So these are the patients. Then some patients may even have acid coming back till their throat, into
Okay.
their mouth also. It's not typically vomiting, but it's the liquid, sour liquid, which is coming up. So these are the patients which should think that maybe there is internal anatomical change. Anatomical change
Mhm.
means some sort of herniation inside, which is
Oh,
this.
okay.
Yeah.
And let's say if they go and see the physician, what are the tests you all suggest them to go forward to check that there is a hernia? Which all tests are required to be done?
Yeah. One more thing I wanted to add on in the symptomatology when we are talking about symptomatology.
Mm.
Uh, One thing first, as I told, it can be a swelling, which you usually notice,
Mm. Mhm.
like in the groin part or the abdominal part. You can see there's a swelling. This swelling usually typically comes up when you exert,
Okay.
when you raise the abdominal pressure. Say if you cough, you can see
Mm.
something is bulging out, maybe at your navel part, maybe little up. So this swelling comes up when you exert.
Okay.
This usually goes down when you lie down, when you give some rest, or you can even press. You can press the swelling, it goes back because it is either the intestine or the fat which is coming out on exertion. So you can, if you can push it down, then definitely it's almost 99% sure. You can also be sure yourself that it's a kind of hernia.
All right.
Usually these hernias, they are usually painless. Usually hernias are painless. You can have little mild discomfort because there is some stretch
Mhm.
on the blood supply or nerve supply on that part of the intestine. So you can have some discomfort, but normally it doesn't cause any pain. And here I want to mention that if you have got pain along with the swelling, similar to this kind of swelling, then this is a warning sign.
Okay.
Because if you are having pain, then that means that hernia is prone for some complications. So immediately you have to go to the doctor if you start having pain. Normally people come to us, yes, I had this swelling for 2 years, 3 years. It was not hurting anymore, so I was just ignoring it. And now for last 3, 4 days, maybe 1 week, I'm having little pain in this part. So
Mhm.
this is the time when you can have actually some complications of hernias. So, and I might remind you that these complications can be really life-threatening in
All right.
some patients. Yeah.
So better they should go and see the doctor on time rather than just
Yes, yes,
thinking.
yes. So whenever you see some abnormal swelling anywhere, you should go and talk to your doctor, physician, surgeon, whosoever is your family doctor. You should go.
So
So
you suggest that first they need to go to physician or obviously.
physician, surgeon, maybe because this is a purely surgical problem. If you have anyone close to you, you can consult a surgeon also, but at least talk to a doctor because he or she
So,
would be able to diagnose it correctly.
so let's say if somebody actually sense it that they could be having such problem like hernia. So the first
Mm.
step is that they have to meet the doctor, and the only way which you think can be sorted is the
Mm.
surgery, or there could be medication for it.
I think let's not come to the surgical part right now.
Okay,
I want to add little more things that
sure, sure.
once you go to the doctor, the clinical examination is very important. And
Yeah.
though most of the doctors, they are well trained in clinically examining the patient and having a mm, sure diagnosis only by examination. This is a clinical diagnosis, we say, that you should be able
Okay.
to find out this is a hernia.
Mm-hmm.
But in certain cases, this might not be possible when the hernias are very small, when
Mm-hmm.
there is only a beginning of hernia. Then in those cases, you can take a help of
Mm-hmm.
ultrasound of the abdomen. Yes. And in certain cases, if it's still not possible, then you can do a CT scan. So all these things
Okay.
can give us an idea. And in case, as I told you about hiatus hernia, then endoscopy is one of the investigation of choice that we do to give
Okay.
us an idea. Okay.
Mm-hmm.
So these things, matlab, they should be done routinely if there is any doubt about the diagnosis.
Done. Done. And what are the treatments which are available?
See, treatment, as I told you, this is a purely surgical problem. There is no medical treatment available. Okay.
Okay.
So it is a dictum that once you diagnose hernias, they should be treated surgically on an urgent basis, not an emergency basis. What I
Okay.
say, you should not let them get into an emergency. Once you
Right.
know, you should plan it out. Maybe just look at your logistics, look at your time frame, look at whenever you are free, then get it done in an elective manner. It's not like appendix. It's not like a stone disease that you get the pain and then you come, okay, doctor, now I'm having pain. Now I
Now,
want to get
like,
it done.
not actually very
Yeah,
well.
because that means you've already stepped into that path where there can be some complication.
Mhm.
It should be done in a planned way, elective way,
Mhm.
because um, mm, surgery is the only option. And usually in surgeries we put some of the prosthetic materials, means some implant is used to give strength to that part. As I told you, it's a gap. It's a hole in your abdominal wall. So you need
Mhm.
to plug that part. Okay. Now once you need to plug that, you can simply suture it, or nowadays it should be done by using some prosthetic material. We put in some mesh over
Okay.
it so that there is some strength given to that part, and it doesn't happen. So once an implant is going into your body and it has to stay there for forever, so you don't want any kind of mishap happening because
Mhm.
of any this thing. So it should be done in an elective manner.
Perfect.
Elective surgeries are the best, yes. But if you somehow land up with pain or some other complications, then definitely what needs to be done at that point of time. And complications, as I told, they can be life-threatening. As I told you that sometimes you have intestine coming out of this hole. See, there is a
Mhm.
hole in your abdominal wall. So intestine might come and it may stay outside. If it stays outside, then it's called an irreducible hernia. It's not going in, and eventually it can cause obstruction. So your small intestine is almost 6 meters long,
Mhm.
and it has to move all the time continuously so that you digest your food. So if there's a point of fixation at the site of hernia, then it gets obstructed. So this becomes now an emergency. In certain cases, there can be like blackening of the intestine. You must have heard like किसकी उंगली काली पड़ गई है ना,
Right.
पैर काला पड़ गया, कि आपने सुना, कॉमन लैंग्वेज में बोलते हैं. This is called gangrene. Same thing can happen with your intestine also. If it stays out of its normal circumference, then it can also get gangrenous. Then the surgeries happen to save the life of the patient, not to repair the hernias. So don't let it go to that stage when you are going in an emergency. Okay?
Sure. Somebody is
Yeah.
asking which statement should about watchful waiting of which inguinal hernia is true. Can you just read out this for me?
Which statement about watchful waiting of inguinal hernia is true? I think there should never be made such a statement that there should be any watchful waiting. As I told you, hernias are purely surgical problem. It's like your this cloth has got torn. Unless you repair it, it's never going to go away. And the other thing I tell everyone that see, there is no activity in word when you are when your abdominal pressure doesn't increase. You're taking breath, even then your abdominal pressure is increasing. You sneeze, you cough, you pass motions, you bend forward, you pick up your little kid, you pick up
Yeah.
any stuff, you do exercise, you do gym, you do, even if you are walking, plain walking, there is some abdominal pressure which is getting increased. So already there is some area of weakening. So it's going
Hmm.
to expand. There is no way it's going to regress. So why do you want to do waitful watching in hernias? Unless you are in some place where this kind of facility is not available, which I fear
Yeah.
doesn't happen in,
Makes sense.
especially in areas like us we live. So, or maybe in waitful watching, maybe in certain cases who are not fit for anesthesia, I'll say. See if the risk of doing the surgery is much more than
Hmm.
doing the surgery itself or waiting for the surgery, then definitely okay, you can keep a watch. This usually happens in people who are old age, very, very old age people with some many comorbidities like heart disease or this thing. So they're not fit for anesthesia per se. Then
Right.
only maybe this option can be there. But other than that, there
Yeah.
is, I don't think this is a good statement to make that you should do a waitful watching in hernias.
Done. So, when you say that the surgical procedure is the one which really requires, so
Hmm.
what do you think that how much time does it this surgery takes, and how I would say how severe it is?
Okay. Yeah, now coming to surgery, this is a very interesting part. Nowadays, most of the surgeries, if you have heard, like gallbladders, appendix, everything is done by keyhole. We call
Hmm.
it laparoscopy. Common
Yeah.
language में लोग लेजर लेजर बोलते आ जाते हैं लेजर है जी लेजर है it's not laser, it's a laparoscopy.
Yep.
So all these procedures now are being done by laparoscopy.
Hmm.
Usually, initially, when we were being trained, we used to do it in an open manner
Right.
means we used
Hmm.
to give a cut over the hernia. We used to find out where the defect is, repair it, put a mesh on top of it, and close the skin back. People
Hmm.
just say, "Oh my God, कितने कितने टाँके आएंगे डॉक्टर साहब? 7-8 7 टाँके आएंगे. इतना बड़ा ऑपरेशन होगा." So
Hmm.
nowadays, all those days are gone now.
Hmm.
Now, more, I think I'll say
Very
more
advanced.
than nine. Yes, more than 90% of the cases they are done by minimal access surgery, keyhole surgery, laparoscopy that you call, where we don't give cuts, we make little holes in your abdomen, and then we deal with this hole from inside. Our main aim is to plug it. Somehow we plug it from outside, we can plug it from inside. If you're plugging it from inside, that means we are doing a laparoscopic repair. So maximum hole that you can have is say around maybe around 5 to 10 millimeters. That's all. Through that 10 millimeter hole, you are putting in a camera, then other maybe 1 or 2 holes, you are making 5 millimeter holes. So through that, you're getting inside, you're putting in a mesh inside, plugging this. So I think this is what we are doing. More than 95% of my patients, prefer this. Even we also prefer this. Recovery is like fast.
Hmm.
Means one day, one single day you are out of hospital. Within 24 hours, you are out of hospital after doing this. And most of the patients, they are out of bed within 4 to 6 hours of surgery. There are
Wonderful.
no UG, there are no tubings or anything outside. Yes,
Hmm.
of course, we do tell them ki, don't exert too much till the time the mesh is fixed, which may take around 3 to 6 weeks to
Hmm.
mingle up with your tissue.
Right.
So till that time, no heavy activity, but yes, we encourage routine activities from the next day itself. We encourage routine walks, stroll. Yes, you should do. And most of the times, people get back to their work within a week's time, at least on their sitting jobs. So it's those days are gone when you used to do surgery and then people used to be
Yeah.
on bed for a long time, then taking rest for 4 weeks, 6 weeks. Those days are gone.
I mean, it's like
So
people are getting aware on it. I think still people are not much aware on the laparoscopic surgeries, and they
yes,
feel that surgery is like that old day surgery. Your
yes,
body
yes.
is gone, and
Mm,
when you actually get into a surgery, you are on a bed for a longer time. So they're not even
yes,
aware that, these days the surgeries are so advanced that
yes.
a lot of things have come up, a lot of machineries, I'm sure the tools have changed, the ways have changed.
Definitely,
And
definitely.
simply
Last
you're
10 to
getting up
15
from the
years.
bed in a day is like magical. It's like you're walking and you're just totally fine. So when people
Yes,
get to know that, they're not scared rather going for a surgery.
yes. And one more thing, see, it's a human tendency that you say कि नहीं जी दर्द तो नहीं हो रहा, अभी तो मेरे को दर्द नहीं हो रहा तो मैं क्यों आके कराऊं? I'm not feeling
Right.
any pain. हाँ?
Yeah.
So again, और सर्जरी से ज्यादा पेन होगा.
Hmm.
अभी मेरे को दर्द नहीं हो रहा है और मैं सर्जरी कराने आ जाऊं तो मेरे को पेन होगा.
फिर मेरे को पेन
So
हो
both the things. हाँ. तो मैं ये क्यों कराऊं? So so now as I told you, you should not be waiting for the pain to happen
रहा.
because that's a sign, that's a warning sign
Yeah,
for
it's like
any
rather
complication.
than getting into a very panicful situation.
Yes. I think that when the surgeries are so advanced,
Yep,
can you hear me?
I
That
lost.
surgical
Yeah,
procedures are so advanced that you are back uh, out of hospital within 24 hours. You're moving around.
mm,
And
mm,
regarding pain also, I have
yeah,
not seen not even 2 to 3% of my patients which need a simple painkiller like Combiflam or Brufen for more than 3 days.
that's
That's
amazing.
how simple it is. Means we just give it Combiflam maybe. This is my routine
Yeah,
post-op analgesic that I give or Brufen also just for 3 days, and people stop taking it. So
that's
considering that
wow.
also, if you see the
Yeah,
pros and cons vis-a-vis the pain, even then the surgical procedure is much
so
better.
smooth. Yeah, sure, sure.
Yeah.
So I think I am almost done with my all the questions for now. Did I miss out anything which really you want to add on?
Uh, One thing, as again and again I'm telling you, don't wait for pain to happen. Don't wait for complications to happen. Things are changed a lot. Things have changed a lot. At least do talk to any of your doctors first, or preferably a surgeon, I'll say. And
Sure, sure.
mm, nothing much. I think you're becoming more for doctor now. You cover practically every point of
Yeah.
hernias.
I'm also learning with you all, and I think that's a blessing. It's
Yeah,
always good to improve, and it's always good to help people in any manner possible. And this is the right platform wherein we keep talking about different topics, and you understand that even if one person listens to it in a proper appropriate manner, this can actually
yeah,
help them and educate them, make them aware about the right decision. That's why the topic name was, you do not wait for the right timing. There's no right timing as such.
there's
It's
no
like
right
you
term.
feel it, you just get it done.
Actually, you're doing a great job. It's a service, I'll say, because this is how you can actually educate the people on a little bigger platform. Otherwise, so it's up to the person himself. Unless he comes to your office, steps into your
Yeah,
clinic, you can't tell anybody like these things.
absolutely, absolutely. Yeah,
So that way,
thanks
you're
a
doing a
lot,
great
Dr.
job.
Anand. It's really,
Yeah,
really
thanks,
a great pleasure for being with you and talking about such wonderful topics. And we'll take another topic with you again soon.
thanks a lot. Always
Thanks,
a pleasure.
thanks so much.